Welcome to China Truths. In this episode, we will bring you the following story. Human metapneumovirus outbreak in China prompts neighboring countries to respond. Now, let's dive into the details. China Truths. Human metapneumovirus outbreak in China prompts neighboring countries to respond. 5 years after the emergence of the COVID virus, another respiratory virus, human metapneumovirus or HMPV, is spreading in China, giving many people a sense of déjà vu and raising fears of another wave of outbreaks. So far, more and more neighboring countries and regions as well as foreign media have expressed concern about the HMPV virus. HMPV is a virus that causes acute respiratory infections. Common symptoms are generally similar to those of the flu, including upper respiratory tract infection symptoms such as cough, fever, nasal congestion, and shortness of breath. But the virus can also cause complications such as bronchitis, tracheitis, pneumonia, asthma, or ear infections. Severe infections may cause severe lower respiratory tract infections. Children under 5 years old, elderly people over 65 years old, and people with low immunity are at high risk of severe infection. Recently, reports and pictures of overcrowded hospitals in China have attracted widespread attention on social media, and some people are worried that HMPV may trigger a new wave of pandemic. Although neither the Chinese government nor the World Health Organization, WHO, has declared the virus a public health emergency, HMPV has attracted the attention of neighboring countries and regions. Recently, multiple HMPV cases have been reported in areas outside mainland China, including Hong Kong and Malaysia. The Cambodian Communicable Disease Control Department has issued a warning noting the similarities between HMPV and COVID-19 and influenza. The Taiwan Centers for Disease Control has warned that the HMPV virus poses a higher risk to children, the elderly, and people with weakened immune systems. India's Ministry of Health commented on the HMPV scare on Saturday, January 4. The Ministry of Health said that the epidemic in China is not unusual and that India will be fully prepared to deal with respiratory diseases. According to the Indian Express, Veena George, Health Minister of the Indian state of Kerala, said, "We are closely monitoring this respiratory disease, especially for children and the elderly." In addition, people coming from other countries, such as China, will also be monitored if they develop respiratory symptoms. However, the current situation does not require any restrictions on foreigners. Dr. Atul Goel of the Directorate General of Health Services of India told Indian TV on Friday, January 3, there is currently news circulating about the outbreak of HMPV in China. However, we have analyzed the respiratory tract diseases in India. In terms of infection data, there is no significant increase in the data in December 2024, and we have not seen a large number of cases reported in any institution. There is no need to panic about the current situation. According to a report by the Malaysian media news Straits Times, the Malaysian Ministry of Health said in a statement on Saturday that as a measure to prevent and control the spread of infection, the Ministry of Health will monitor the situation at home and abroad. According to Pakistan's Sama TV, the country's Ministry of Health Services has directed the National Institutes of Health, NIH, to closely monitor the virus and has arranged a video conference to invite health officials and medical experts to assess the situation and formulate responses. Canada's Toronto Star, the United States Newsweek, the United Kingdom's The Independent, as well as many media in India, Malaysia, Pakistan and other countries have reported on China's transmitted HMPV virus. Taiwanese media also reported on the virus. 5 years ago, COVID virus infections first broke out in Wuhan, China. Because the CCP concealed the epidemic at the time, the virus spread rapidly. Not only did the entire Wuhan become a hardest-hit area, the virus also spread overseas and turned into a global pandemic, causing a large number of deaths. Many families have not yet been able to escape the pain and trauma caused by the pandemic. However, the CCP has not only concealed the epidemic, but has also refused to share real information about the COVID-19 virus with international investigation teams. As recently as Tuesday, December 31, 2024, the World Health Organization, WHO, said, we continue to call on China to share data and access so that we can understand the origins of COVID-19. This is an ethical and scientific imperative. Without transparency, information, sharing and cooperation between countries, the world will not be able to adequately prevent and prepare for future epidemics and pandemics, the WHO said. Regarding the recent outbreak of the HMPV virus in China, the British Independent said that although the health department is taking emergency measures to monitor and control the spread, Beijing has downplayed this development, calling it an annual winter event. However, many photos and videos of people wearing masks in hospitals have appeared on social media, and local media said the HMPV outbreak was similar to the initial COVID outbreak. Mao Ning, spokesman for China Ministry of Foreign Affairs, tried to downplay the situation at a regular press conference on Friday, January 3, saying that winter is the season of high incidence of respiratory infections in the Northern Hemisphere. At present, the scale and intensity of the epidemic of related diseases are lower than last year. However, the results of interviews with foreign media showed a different picture. The owner of a pharmacy in Dongqing District, Beijing, told Taiwanese media Central News Agency that there are too many people with colds this year and cold medicines are out of stock. The grand situation will not be too different from that in 2022 when the dynamic clearing is about to be released. During an interview with a reporter from the Central News Agency, 4 customers came to the door to buy cold medicines one after another. There were old people and young people. 2 of them wanted to buy medicines that were out of stock. Ms. Wang, a Beijing resident, told a reporter from Central News Agency that there were obviously more people suffering from colds this winter than last winter. She just sent her son to Beijing Hospital for treatment on December 30th last year. The respiratory department was almost full, and so was the nearby Tongren Hospital. In this way, she once felt that it might be more dangerous for her son to be exposed to a hospital full of viruses. In order to be cured as soon as possible, she decided to let her son receive treatment in the hospital. The Fuzhou Center for Disease Control and Prevention published an article on December 27, 2024 titled "Similar to the Flu? HMPV is menacing and generally susceptible." The article said that HMPV likes to pick on children and the elderly for heavy attacks. The Centers for Disease Control and Prevention also said that currently, there is no vaccine or specific drugs for the HMPV virus, and treatment measures are mostly supportive treatment of symptoms. The Cleveland Clinic, a world-renowned medical institution, said on its website that there are currently no antiviral drugs to treat HMPV. Severe cases require hospitalization. The virus is spread through direct contact with an infected person or by touching items contaminated with the virus, including shaking hands, hugging, or touching surfaces or items such as cell phones, doorknobs, keyboards, or toys. The virus can also be spread through coughing and sneezing.